All right, let's talk about one of the most common, frustrating problems out there, chronic back and neck pain. Today, we're diving into a really cool technological shift that's changing how doctors treat it. We're talking about moving from a blurry, kind of indirect approach to a crystal clear, real-time view of what's actually causing the pain. Let's get into it.
So, let me start with this question. What if a doctor could stop just estimating and instead literally see the off switch for your pain signal live on a screen? I mean, actually watch as they guide a needle right to that switch and turn it off. And you know, that might sound like something out of science fiction, but it's not. It's the whole idea behind a major leap forward in pain management.
So, where does so much of this nagging, stubborn spinal pain even come from? Well, for a huge number of people, the answer is hiding in these tiny little structures all along your spine. They're called the facet joints.
Okay, so what are these things? Think of your facet joints like little knuckles that connect your vertebrae, keeping your spine stable. But, and this is the crucial part, they are surrounded by tiny nerve fibers. So when these joints get inflamed or damaged, whether it's from arthritis or an injury or just everyday wear and tear, those nerves start sending out pain signals like crazy. That's what causes that persistent, deep ache in the neck and lower back.
And get this is not some rare issue. The numbers here are just staggering. Studies are now suggesting that these little joints could be the root cause for up to 67% of chronic neck pain. And for chronic low back pain, that number is as high as 41%. That is a massive amount of suffering that all starts right here.
So for decades, how have doctors been trying to deal with this? Well, the traditional method has been a procedure called a medial branch block, and it's always been guided by X-rays. You can really think of it as trying to find a needle in a bony haystack.
Now, the goal itself is pretty simple, and honestly, it's brilliant. There's this tiny nerve called the medial branch that acts like a wire. It carries the pain signal from that angry facet joint straight to your brain. So the whole idea is to get a little drop of anesthetic right onto that wire, basically shutting off the signal. This both diagnoses the problem and hopefully gives you some immediate relief.
But here's the fundamental problem with the old method, which uses a live X-ray called fluoroscopy. Your target is this tiny, soft nerve. And what do X-rays see best? Right, bone. The nerve itself is completely invisible, or radiolucent, as they call it. This means doctors have to rely on bony landmarks to just guess where the nerve probably is.
So, you can see how this old method starts to stack up some pretty serious drawbacks. First, you've got radiation exposure, not just for the patient, but for the doctor too. As we said, the target you're aiming for is invisible. This means the procedure can be a lot slower, with the doctor having to make more and more needle adjustments to find just the right spot. And the whole thing requires this big, bulky, specialized equipment.
And this is where the new approach comes in. Enter the real game changer here, ultrasound. It is literally giving doctors a whole new set of eyes and completely changing how they do this procedure.
And hey, don't just take my word for it. A recent review in the journal Clinical Pain put it really simply. They said ultrasound is useful for visualizing inner structures, it's portable, and, this is a big one, it's not associated with radiation exposure.
So let's break down these advantages. You could almost call them ultrasound's superpowers. Unlike an X-ray, it's amazing at seeing soft tissues, which means doctors can often see the nerve itself, not just the bone around it. It gives them a live video feed of the needle as it travels. There is zero radiation. And the machine itself is portable. You can wheel it right up to the patient's bedside.
Okay, so how does this actually work in the real world? Let's take a quick little guided tour of what an ultrasound-guided block looks like.
So the target for the needle is a very specific spot. In both your neck and your lower back, that little medial branch nerve almost always sits in a specific bony groove. And this is the key, right? With an X-ray, finding that groove is just an estimate based on shadows. With ultrasound, doctors can often see it directly, right there on the screen.
The whole thing really boils down to 4 simple steps. First, the doctor just scans the spine with the ultrasound wand to find the exact right vertebra. Second, they pinpoint that bony groove we just talked about. Third, and this is the magic part, they watch the needle on the screen in real time as they guide it right to the target.
And finally, they inject the medicine and can actually see it spread around the nerve, confirming they got it in the perfect spot.
Doctors even have a couple of different ways they can do this. They can guide the needle in plane, which lets them see the entire length of the needle from start to finish, or they can go out of plane, where they just track the very tip of the needle as a little bright dot. Each way has its own advantages, which gives the doctor more flexibility depending on the patient's unique anatomy.
Okay, so it all sounds amazing on paper. It's safer, it's more precise. But what does the actual data say? Is it really faster? Is it just as effective? Let's check out the verdict from the research.
Well, when it comes to efficiency, the evidence is pretty overwhelming. Study after study shows that ultrasound procedures are significantly faster than the old X-ray method. And it makes sense, right? When you can see exactly what you're doing, it takes fewer needle pokes and adjustments, which means less time on the table and less discomfort for the patient.
But what about accuracy? I mean, that's the multi-million-dollar question, isn't it? Well, to figure this out, researchers have actually done the ultrasound procedure and then immediately double-checked their work with a CT scan. The results? They found the needle was in the perfect spot up to 95% of the time. That is just an incredible level of precision.
So at the end of the day, does this faster, more accurate, radiation-free method actually work? Does it relieve the pain? The answer is a clear yes. Head-to-head studies have found that the results are totally comparable to the old fluoroscopy method, with patients getting significant pain relief that can last for as long as 6 months.
Now, to be totally fair and give you the full picture, it is important to mention one key difference. With X-rays, doctors can inject a contrast dye to make 100% sure the needle isn't in a tiny blood vessel. You can't do that with ultrasound. Now, ultrasound can see the bigger blood vessels so the doctor can avoid them, but this limitation really means that the procedure requires a very high level of skill and anatomical knowledge from the doctor performing it.
So all of this leads to a really profound shift in thinking, which the researchers captured perfectly. For years, this procedure was mostly seen as a diagnostic tool. It was a test to figure out if the facet joint was the problem. But now, because it's so safe and accurate and efficient, it's becoming a primary therapeutic treatment all on its own. It's not just for finding the pain anymore, it's for fixing it.
And that brings us full circle. By giving doctors the ability to finally see the invisible, ultrasound is making pain management safer, it's making it faster, and it's making it more accessible. Which really just leaves us with one final big question. With real-time vision and zero radiation, are we looking at the new gold standard for treating this kind of chronic pain? Thanks for joining us on The Explainer.